Hello everybody, welcome to the final meeting of our TIMELY project. With TIMELY we have developed an innovative digital solution that aims to pave the future for the healthcare. With intelligent solutions, we support patients from primary prevention to treatment to secondary prevention and rehabilitation. And it's not only about improving the quality of life of the patients, it's also about making processes much more efficient in hospitals and outpatient settings. After 4 years of intensive work and collaboration on the development of the platform and the app, we want to show you today what we have achieved. As Biotronic, we've led the dissemination work package, and in this function we are hosting this event. And with this said, I hand over to Jos, our project leader.
Thank you very much, Carolina, for the good introduction as well. So I've prepared a nice presentation and I first want to welcome our guest of honor. So I go through the agenda briefly. So we start with a welcome, and I will do the next part. I will explain why do we need TIMELY and how does it work. What is TIMELY actually? And then Boris will tell more about the clinical effectiveness, and you hear about patient experiences, and we lead you through the agenda as the presentation progresses. So again, thank you for the opportunity to introduce the TIMELY to you and for being on board, all of you. Of course, our guest of honor today is Mirjam Bosnik, our program officer who supported us so very well through the past years, and not least our members of our advisory board, Susan Peterson, Alberto Catapano, the team of the University of Las Palmas, and the team from Professor Helms. So without much further ado, well, TIMELY is a patient-centered early risk prediction, prevention and intervention platform to support the continuum of care in coronary artery disease using e-health and artificial intelligence. Well, e-health has been in the picture for a while now and provides multiple benefits. It's become increasingly popular. One of its conceptual improvements is that it extends the care partnership beyond the on-site cardiac rehabilitation, but brings it to the patient's home and the patient's social environment, its daily life. And so that has a number of benefits. It provides a more structural ongoing support for adopting, maintaining healthy lifestyle, which is the core of cardiac rehabilitation. It enables monitoring in the home environment. This technology helps to identify and address risk factors early on, therefore, and reducing the likelihood of setbacks and complications. And a third aspect is that it can provide less personnel intensive care delivery, for example, by stepped care approaches, better indication early on, and it can be minimized. I was a little bit distracted, something appeared on my screen, people at home, I apologize for that. And so, well, a patient like it, that's another important one. I mean, I have an Apple Watch on, and probably many of you on board as well. It's extremely popular, it's a €1 billion market. That shows that patients like to monitor themselves. But the bottom line is it will increase care quality and availability while decreasing costs, which is of course the conundrum in health economics. How do you make it more available while making it less costly? It has a very, very good evidence base. This is just a slide from the ESC guidelines for management of coronary artery disease, coronary syndromes, I apologize. And left you see the high class evidence that is for these approaches. So you may wonder, why is not everybody already doing it? Well, it's very challenging. Many disciplines are involved to get this done, and we were very lucky to get funded by the EU, and that allows us to put such a diverse team of super specialists together. These include software engineers, behavioral scientists, clinicians, health economics, people who are specialists in AI and machine learning, data scientists, and companies that understand the marketing, hardware and product development, and clinical trial specialists. And I'm sure I left a few specialties out, and we're very grateful also for the input of our advisory board, which is another level of expertise that was brought into our project. And this is quickly a segment of our team. There's 27 people, and we have a much larger team, not on board, but a lot of people were involved. So what we wanted to try to achieve is that we aim to care support in both the clinical and subsequent home environment. The Timely platform aspires for improvement for the entire care pathway and implementing AI-powered e-health innovations for more personalized care. So this approach has been identified by the European Association of Preventive Cardiology as the most promising way to tackle the challenges inherent to conventional cardiac treatment. So we do believe we deliver something that both the clinicians and the patients and the market wants. So now what's Timely? I will try to be more precise. Timely is a very comprehensive modular e-health platform, so it has many components. That's what modular means, and that aims to support both the clinician and the patient undergoing cardiac rehabilitation and their shared decision making. It aspires to provide a digitized care platform that captures all aspects of care pathway for cardiac rehabilitation patients. And modular, this circle explains, I'm not sure whether I have the time, it makes sense to go through all the elements that are in there, but it has clinical intervention, data management, it has a medication plan, discharge management, ambulatory monitoring of blood pressure, ECG activities. I think compliance is also part of that monitoring. Individual analysis that's been used in case management, individualized training recommendations, psychocardiac support, stress management, a chatbot that's available for coaching and therapeutic intervention 24/7, a knowledge database. So it provides a lot of elements for the patient. So you can also analyze the platform in terms of what do you get in the box. So if you say, I want to have 4 pieces of Timely, what do you get? Well, it provides a digitized care platform that captures all aspects of the care pathway for cardiac rehabilitation patients. So the platform involves remote assessment and monitoring relevant to care. It provides a safe server infrastructure for data collection and sharing, and communication infrastructure that includes dashboards for sharing information between patients, clinicians, and case managers, a decision support tool for the clinician and other caretakers, and even the patient, and behavior change support for the patient that can continue beyond the clinic into the home environment. And that behavior change tools involve the psychosocial behavioral assessment on a daily basis, so in the moment for the patient itself, chatbot behavior change, and context-sensitive mobile coaches. So depending on where you are, what the weather is, what time of day it is, the type of information and feedback you get and coaching you get will differ. And keep in mind that those behavioral interventions are strongly evidence-based. So this is apart from a review we just published. We make careful identification with patients and also from the literature. What are the main problems and behaviors, the barriers to changing behavior that patients have experienced, and what are the most effective behavioral technology, behavior change techniques. And just as a side, I want to mention 2 things that really stood out for me. That the type of intervention you choose, the behavior change technique that you use, is very much targeted to the particular behavior that you want to change. What could be extremely helpful for medication compliance or physical activity could actually not be helpful for smoking, or even detrimental, or even harmful to that. And what we also, I thought was a striking finding, is that what patients like or would like to have recommended as a behavior change technique may not always be the best choice for them. So it's a mix of top-down knowledge and bottom-up feedback from the patients that will decide, and it shows that behavior change technology is really a thing for specialists, behavior scientists, and not in this area where everybody can call himself a life coach. That's sometimes refreshing to realize. So this far what I showed you is what we came up with, right? It's very top down. Very core, essential to what we do as a core principle is that we have a bottom-up approach in two ways. The first way is that the patient co-develop everything that we have developed here. So we include patients in all the way through the process and also clinicians in all phases of the development, and for that we use a living lab approach. So the living lab consists of doing interviews, filling out quantitative data questionnaires, having focus groups. There we first start with mock-ups and quasi-forms of our tools. That's being fed back to the users, to the stakeholders, patients or clinicians, and that iterative process costs constant improvement. And so we get almost like a Russian election. 93% of the patients support the approach. And that is because it is really developed together with them. It makes it the acceptability great, but also the quality great, I think. The other bottom-up approach that we use is bottom-up from the data. So we use AI, and AI starts with data. Lots of it, which need to be processed in an analytical framework, and that data provides fuel for AI-powered tools that generate actionable insights for the decision support for the clinician, and relevant health status information for both the clinician and the patient, lifestyle and behavior support for the patients. It's all data-driven. And finally, this wealth of information then communicated and made accessible through workflow integration that presents itself, for example, in dashboards or apps, visualizations. I will show you a little bit of that more in a minute. So the patient focus that we use, or the clinician focus that we use, I shouldn't forget about that, gives patients acceptance. And so in that way we have a tool that integrates analysis of behavioral data, can do personalized risk predictions, have case management support, and provides individualized and context-relevant coaching recommendations. So the patient gets a lot of information, gets it through its own data that it collects and being processed, but at the same time through various tools and microprocessors that we have developed. Personalized coaching, individualized training programs, monitoring of risk factors, and psychosocial assessment and management. And so you see the patient in the center of all that. It reads its own data, being processed, being made understandable and acceptable to them, and at the same time that information is fed to AI models that provide advice and make it personalized, provide personalized intervention forms. So this is an app that we have developed, and I want to show you just to make it visual a little bit. I mean, this is a phone app. This is the front screen, the wireframe, if you wish, for the app. It has certain buttons. The patient goes in there, and for example, there's a button here that shows you a training program and training process program. Another button leads the patient to the chatbot for behavioral change interventions, support, mental support, mood support, behavioral support. There's a message center that gives context-dependent, for the patient, relevant information at the time it's relevant. And it also provides a knowledge center. So you can look up all sorts of things about your disease, your medication, the hospital you're in, in a very accessible way through your app. This is another, you see the left button downstairs, it provides you to another screen that again provides all sorts of monitoring data for the patient. For example, step counts, calorie use, all sorts of information, blood pressure, heart rate, all the information that's relevant to the patient. And that's one of the things that the patients like the most. They'll really enjoy monitoring themselves and being aware of their health status. I have now another aspect that this is basically the screen for the case manager. And Boris will tell a little bit more about that, because he has been really instrumental in developing this concept and has much hands-on experience with that. Boris, I will move out the screen and give it to you.
Thank you, Jos. Yeah, I'm Boris Schmitz. I'm work package leader in the TIMELY project. I'm with one of the clinical centers, actually the Klinik Königsfeld in Germany. And we will now have a short look at what the case manager see when they take care of the patients. So this is the platform view. This is a short video we took in the beginning. So you see here, when you start your day, the tasks which patients do actually have to look at. Is there any problems? You can access the long-term ECG results. You see the blood pressure of the patient. You see the step counts of the patient. So basically all the data that the patient gathers is available for the case manager. Here we visualize the questionnaires of the patients. For instance, smoking habits. We also see perceived stress. This can be changed through the individual assessing points throughout the process. We have another questionnaire here visualized for a healthy diet. Basically all the questionnaires that the patients answer throughout the project can be visualized here, also with a color indication, so that you know if there's anything not in order. Here's where you set the thresholds for blood pressure for not receiving any measurements. And to those thresholds, you will get then a report of the patient. As you see here, there's some no actions required, some other actions required for like patient reporting symptoms, which is the top one. Of course, if a patient reports symptoms after being active, you need to call him immediately. Yeah, here again you see the steps recorded over the entire lifetime of the patient being in the project, which is 6 months. This is exercise training activities. This is the mean blood pressure by month in this case. We see the exercise prescription we produce for the patient, which is basically an AI-based tool which produces recommendations for exercise for the patient on a weekly basis based on what he did in the past week. So this is week 28. He can exercise for 20 or 30 minutes. The case manager can adapt that. This is the frequency, how often you exercise per week. Basically, this is an automatic process, and the case manager can adjust it and then save and approve it, and then it will be shown in the patient app, so the patient knows exactly how and how often, at what intensity to exercise in that week. Yeah. So this is basically the platform view. We will now see a short video of one of our patients and her experience with the TIMELY project. The video is in German, but the subtitle is in English.
Ja, hallo. Ich hatte im November 22 einen Herzinfarkt, Hinterwandinfarkt, war dann noch ein paar Tage zu Hause und bin dann über Weihnachten und Silvester in die Reha-Klinik gekommen und habe mich dann gleich dem TIMELY-Projekt angeschlossen, Herzforschung, und es war ganz, ganz toll. Also die Blutdruckmessung fand ich super. Ich habe mir das dann auch immer notiert, und das war natürlich auch eine super Sache für meine Hausärztin und auch für meinen Kardiologen. Der hat natürlich auch die Forschungsergebnisse von TIMELY bekommen, also die ganzen Auswertungsbögen, und das fand er natürlich auch sehr, sehr hilfreich. Und so konnte ich dann auch eine Tablette reduzieren. Sonst wäre das wahrscheinlich nicht so gegangen, ne? Also ich komme da ganz gut mit klar, ja. Das hat mir sehr geholfen. Man bekommt dann auch immer ein Fitnessprogramm geschickt, was sich so langsam steigert. Und das fand ich auch sehr, sehr hilfreich. Auch damit man lernt, an seine Grenzen zu gehen, aber nicht über die Grenzen hinaus. Ja, also wenn ich so 10.000 Schritte gemacht habe und darüber hinaus, dann kam natürlich gleich was Geschriebenes, hier super gemacht. Also ich habe also zum Beispiel selber gemerkt, dadurch, dass auch Cholesterin dann regelmäßig gemessen wurde, das schlimme LDL, lass die Leberwurst, ne? Ich liebe Leberwurst. Und naja, man denkt dann da immer dran, ne? Also das hat sich schon ganz schön verinnerlicht, dass man halt nicht vergisst, was man isst. Also eine Rückkehr in das Programm nach einem halben Jahr oder Jahr würde ich auf jeden Fall befürworten, allein aus meiner Erfahrung heraus. Und was ich jetzt sehe bei meinen Herzpatientinnen, die nicht an dem TIMELY-Projekt teilgenommen haben, das wird denen wirklich, wirklich gut tun. Ja.
Yeah, thank you for listening to this patient story. We were very happy to have this motivated patient in the project. And the interesting thing about that is she's a trainer herself. She also trains with patients after rehabilitation and after myocardial infarction or other cardiac events. And she was really fascinated, as you can tell, from the project. So now we get a bit more technical. We will look at the data for the health technology assessment, which is being provided by our Spanish partner, Ideval. And if they're here, they will be online and present their data just now.
Okay, let us explain about some slides, some pieces of information about the big question, about this. No, the big question we think that is about this timely, cost effective. No, so this is the idea or the main idea in our presentation. And what about the economic evaluation? We suppose that there are two questions. There could be questions about both costs and outcomes or alternative assets. Or, for example, is the comparison of more alternatives is reliable or is interesting for this issue? And our answer obviously is yes. And about the full economic evaluation, I want to focus on the big issue or the big economic tool that is about the cost effectiveness analysis. So this our idea, about our idea of economic evaluation that is mainly focused on the cost effectiveness or the cost utility analysis. Our main problem is the data collected in the research project, the TIMELY project, that probably we have to consider, for example, the direct medical costs, about the cost of medication, about the direct non-medical costs, about, for example, the informal care or the patient time, our intervention, because it's very difficult, for example, to estimate indirect and non-medical costs, about the productivity loss, about, for example, the change in the quality of life, or these kind of things. We know that is very difficult, but this is the idea in order to introduce an economic evaluation. So the economic evaluation or the idea that we are interested in, for example, in to measure the incremental cost effectiveness ratio, and obviously is the ratio when we can consider, for example, the difference between the cost and the difference between the effectiveness. And what about what is what is the situation or where is located TIMELY? And we think that is very important that we are going to demonstrate. My partner, the Professor Paloma Lanza, is going to explain you about, for example, the change in the health outcomes and the change in costs. And our idea is that TIMELY is going to be located on the quadrant 2 and is related probably with less cost and better health outcomes. So this is the main idea or the big idea. And Paloma is going to explain you the next slides.
Okay, as David said, we have considered in the cost effectiveness analysis the first, the clinical data. We are going to indicate the core predict, that is the probability of relapse. In the case of the cost data, we are going to indicate cost, direct cost, non-medical direct cost, as well as indirect cost. Also, we have included the implementation cost of TIMELY. And what is important here to take into consideration is to consider the societal perspective. So we are going to present the 3 countries, Spain, Germany, and the Netherlands. In the case of Spain, you can see here, first of all, the direct cost, which is the same that the phase 1 of the cardiac rehabilitation. So it is the hospitalization. Here, in the case of Spain, we have calculated on the basis of the diagnosis-related group. This data is provided by the Spanish Ministry of Health. So you have the data that is around more than 4,000. In the case of indirect costs, which would include that there is the productivity losses from the patients, that is the economic burden of work absenteeism due to the disease. And we have calculated this value as the number of days patients are unable to work. In the case of Spain, it is 130 days, and the cost per day. We have calculated this data from the literature because we don't have the exactly number for our patients. In the case of the phase 2, after hospitalization, we have the data for TIMELY, that is the cost of the implementation of TIMELY. In this case, we have, for example, this column with TIMELY per month cost in years. So per patient, we have cost less than 100. Okay, and for example, in the phase 3 is the maintenance. This is carried out by the patient. So, for example, in the case of TIMELY, it has a cost of 90 years per month. And in the case of non-TIMELY, we have considered the cardiac rehabilitation session or visits that the patient has to do with a health professional. In the case of the data of the cost effectiveness, we have the core predict. As I have said before, this is the probability of relapse. So TIMELY improves the usual cardiac rehabilitation by 6 points in the case of Spain. And as David said before, we can conclude that in the case of Spain, TIMELY is cost effective. Very similar to the case of Germany. In this case, the data for the direct cost of the phase 1 of hospitalization is provided by the literature. Here you have at the end of the slide the reference, okay? But the indirect cost, the after hospitalization, and the maintenance is similar as we have calculated in the case of Spain. And if we go at the key issue of the cost effectiveness, we can conclude that it is cost effectiveness again. Okay, here we have the total cost with TIMELY and with the usual care of cardiac rehabilitation. And we can conclude that TIMELY is costs are lower for TIMELY. And the same for for the Netherlands. In this case, the same as we did in the case of Germany. The phase 1, the hospitalization cost, that direct cost, is provided by the literature. In the case of indirect cost, after hospitalization and maintenance cost, we have calculated, like in the case of Spain. So in the case of the cost effectiveness results, Again, the core predict indicate us that the health outcomes improve with timely as well as costs. So the ratio for the cost effectiveness analysis indicates that timely is cost effectiveness. And to finish our presentation, as David points out, that timely is in the second quadrant. Okay, so we can conclude that timely is cost effectiveness because it reduces the cost of the disease and the rehabilitation and improves the health outcomes. So thank you.
Okay, thank you very much. You might have seen that there was a little bit of a change in the agenda. This is because I will also present the last part, which is the implementation, and I think this is better now. Okay, so we can now look at the actual timely data that we have from the intervention and also look at some patient experiences. Just a reminder, we have 3 centers that recruited patients. Of course, the clinic in Germany where I'm from, Klinik Königsfeld, then the clinic in Santiago de Compostela in the north of Spain, and the Tilburg Center in the Netherlands. We have included 119 patients at our center, 1 was withdrawn, 129 in Spain, 1 was a screening failure, and 110 in Tilburg. We also have here the numbers for the T2 visits performed. The T2 visits are after 6 months, and then we are currently in the T3 visits, which are ongoing, but all T3 visits will be finished by the 6th of May. Just a reminder, some of you might already have seen this. We had an RCT design which compares 180 timely patients to 180 care as usual patients. The patients were equipped with a blood pressure monitor, the app, 24-hour ECG monitor, and an activity tracker, and they were using the app, and the case managers were using the platform. As we just showed you, the intervention was 6 months, and then there's also an additional 6 months up to 12 months for like the long-term effect. Well, the inclusion criteria are documented down here on the left. Basically was stable cut patients that were referred to cardiac rehabilitation with a certain time frame after PCI or CABG or AMI, and these patients were included. So what are we measuring? There's 2 primary outcome measures. One is the change in risk of mortality, which is documented by a biomarker score, which is the core predict score, which predicts the mortality over the next 10 years. And then we have a change in functional fitness levels, which is basically the 6-minute walking test. Those are assessed after 6 months. And then we have secondary outcome measures, which are change in physical activity by IPAC questionnaire, the change in cardiovascular exercise tolerance, which is the typical ergometer testing. Then we have change in dietary habits, change in weight, smoking cessation, change in medication adherence, and the psychological stress levels, which are measured by questionnaires at 3 and at 6 months. So we can now look at some of the patient experience, which is very important. And you see here some statements of our patients. There is voices like this one. Timely is fairly simple, straightforward in terms of monitoring, and it made some of the patients decide that after Timely they had to give back the devices. They wanted something similar and bought like a heart rate monitor and something like that themselves. Patients also mentioned that they're very glad that someone is looking at them and their condition, which was basically something a lot of patients mentioned, that they felt very taken care of, knowing that someone is looking at their data as we did. And down here is one of the oldest patients, 81 years from Spain, and he documented that he had no problems adapting to the devices. He enjoyed seeing his data. He also had no problems working with the app, and he liked keeping track of his activities. These are some voices. Of course, there's also some more critical ones, but these are the ones that stood out to us because a lot of patients mentioned stuff like this. We also ran some questionnaires on the user acceptance and the technology, how the patient actually liked it. These are parts of the SUS and other questionnaires. So a lot of patients actually mentioned that they agree that TIMELY is easy to use. The functions that we planned were well integrated. They also said that learning to use TIMELY is easy and it provides consistent healthcare. The attention provided by TIMELY in combination with the case managers was considered adequate, and overall the patients were satisfied with the quality of TIMELY, which is, as you can see here, the majority of the patients, and I think a very good result. Now we can look at the blood pressure monitoring. We had 179 patients that actually were equipped with the devices, and when we calculate over the 6 months, we will see that 1.3 measurements were done on average per day, and we had an engagement rate of about 70%. That is, the patients provided regular data in terms of 90% of the days. That is 9 out of 10 days, 70% of the patients provided blood pressure measurements. What we did see is that 60% of the patients who measured blood pressure in the intervention group experienced a drop, and the mean drop in this group was 10 millimeters systolic and 8 millimeters diastolic of those patients. And at the end, for the last measurements we had for those patients, 85% of the patients had a blood pressure below 140 to 100, and 35% of them were actually on target, which is 120 to 80 in this case. And the feedback from the patients and also from the case managers and practitioners was very positive for the blood pressure measurements. If we look a little bit deeper into the measurements that we had, I think it was about 40,000 individual measurements that we received. We can see that 24 hours after performing an aerobic exercise, the blood pressure, systolic blood pressure, was lower on average, 123 millimeters Hg on average, compared to those days where the same patients did not exercise. On those days, the blood pressure systolic was 5 millimeters higher, 127 on average, which is highly significant. So we can show that doing exercise, and we also show this to the patients, that doing exercise actually lowers the blood pressure for the next 24 hours. So in terms of effectiveness, we can now look at the patients that were randomized. Overall, you see we have about 22.5% women involved in the trial. And this is the overall data. The randomization worked pretty well. Intervention control, highly comparable. And when we look at the main outcome, which is the mortality risk assessed by the core predict, and now we're looking at the 6-month follow-up in the intention to treat analysis, meaning we're looking at every patient that was randomized, no matter if he took the pill or if he didn't take the pill, meaning if he didn't use the TIMELY, he's also in here. So what we do see is there is basically a difference between the centers, which is likely based on the age difference. The oldest patients are in Tilburg, the middle age group is in Spain, and we have the youngest in Germany. And the duration of the actual phase 2 rehabilitation. The Spanish rehabilitation is outpatient rehabilitation for a longer time period than the inpatient rehabilitation in Germany. And the Netherlands actually do a very short period of customizing the patients to exercise. And we can see those differences here. And we also see that there is basically no difference between the intervention and the control group at the 6-month time point in the ITT analysis. We do see the same for the functional fitness, which is the 6-minute walking test. Also at 6 months in the ITT analysis, no difference between the control and intervention group. The same is true for exercise tolerance, which is basically the watts per kilogram on the ergometer test in the center, and for weight. And we also see no difference for the secondary outcome measures in terms of activity measured by the IPAC questionnaire, or the dietary habits, or the patient's medication adherence, here shown on the right. And we also don't see a difference in perceived stress, and smoking cessation actually was not a topic here because most of the patients were non-smokers. We only have a 7.9% about in the control group, which is the highest here. So very low rates of actually smoking patients. Now, what is of interest is, are the users of TIMELY better off at 6 months than the control group? And there's a yes here for the exercise tolerance, because if we set the threshold for 2/3 of the actual usage of TIMELY, which is the adherence index that is basically based on how often patients exercised, how often they actually transmitted the data, we can see that the watts per kilogram as a measure of exercise tolerance is better in the intervention group than in the control group. If we look a little bit deeper into that, we have 2 centers, and one of them is Spain, that also measured, doing the same test, the oxygen uptake of the patients, which is a very, very fine measure for those who don't know, to know how fit actually someone is. And we can see here very nicely with this methodology that the intervention patients have a greater uptake in oxygen when they do the actual ergometer testing, meaning they're fitter than those in the control group, meaning that with TIMELY, the fitness increases. Also, we can show that using more TIMELY, which is here depicted by the activity weeks, all the total steps, that you have a lower rate of troponin in your blood. The more active weeks, the lower the troponin rate. You have more vitamin D, which is protective for your vessels and your heart. And you do have higher rates of HDL with more steps that you do with TIMELY. So active TIMELY patients have better outcomes than in terms of soft measurements here in the blood than non-active TIMELY users. Who are actually the active TIMELY users? We have run some modeling over this. Actually, the Greek partner has done this, and we can see, which is something that you might anticipate, that younger patients are more active in using TIMELY. It's approximate 5 years from the mean, and which I find a bit surprising, females are actually more active TIMELY users. On the other hand, of course, the older patients are less or using TIMELY less, and they're male. But we also see that those who have chronic kidney disease or chest pain are not actively using TIMELY. And this is something which we can actually use to learn how to educate those patients better, that also for them it is very important to be active, because those with chronic kidney disease and chest pain can benefit from more activity, but they might feel they're not feeling so good when they do. So we can teach them and educate them that also for those patients doing more exercise is actually very helpful. So we do know who are the active TIMELY users. And with this, this part of the presentation ends. We will now go to how do we actually bring TIMELY to the clinical practice. And here we are now. I'm also presenting this because the person who developed this slide is actually sick today. So how do we do this? Basically, we have 2 approaches for Germany and 1 central approach for Spain. And since we have developed TIMELY within our clinic, and our clinic is part of the German Pension Fund, the most intriguing or the most clear vision we have for this is to bring TIMELY into the clinics of the German Pension Fund. We will also look into getting TIMELY reimbursed by special care contracts with insurers in Germany, which is basically called here the phase 1B. So for the patients that we have in the German Pension Fund, it's about 1 million medical rehabilitation cases billed through the German Pension Fund per year. And there is an estimate about 75,000 patients that are eligible for TIMELY in phase 3. As a matter of fact, I think it's more, but this is the number we have here. Those patients would usually be eligible for the digital arena project, which is basically the intensified aftercare that we use in Germany, and some of the controls in our control group were also in the regular arena project. So if we set up TIMELY as a digital arena program, it would be reimbursed with up to 640 euros per patient per 6 months. So for the main requirement to set up a special care contract, this is of course something that needs to be prepared. We need to talk to insurers, which we're already doing, and we need to have a clear statement from the physicians what does actually TIMELY need to bring to the table that it can be reimbursed in one of those contracts. And the first meeting with the leading physicians in the field will actually happen on April this year, and then we come hopefully with a white paper to the insurers and tell them what we consider that TIMELY will bring. We have a very good experience with something that is comparable to TIMELY, which is currently the telematic structure that we have for heart failure in Germany, and basically TIMELY will follow the same approach. There is also already a program in place in Germany, which is basically a disease management program for patients with CAD. Currently, they just see their local doctor, their general practitioner, 4 times a year for blood pressure measurement and lipids. But there is nothing related to this as in terms of an intervention. So basically, if you do see that the values are not good, you can only intensify the medication, but there's nothing else. There's no recommendations for physical activity, no regular blood pressure control at home, no patient education, and this is something that we think TIMELY can bring into this already existing management program, so we can offer TIMELY as part of a solution for those patients who don't have good values and are screened in this program. This is something we have already seen in a different view. This is basically the ESC guidelines from 2024, which recommend behavioral interventions and mobile health as TIMELY does provide. And so specifically for the management of CAD patients, according to the guidelines, TIMELY is a very good fit. It is, will be a new telemonitoring model for CAD patients, of course. We have the opportunity here also to close the gaps between those patients who do the intensified rehabilitation aftercare and then would be taken over by the insurers, at least in Germany. So we are trying also to introduce TIMELY into the already existing telemonitoring infrastructure, which is basically built by Biotronic and Somdatics, our partners, on the heart failure case. There is something that exists in Germany, which are special care contracts of a company to one of the insurers. For these contracts, let's say the hurdles are a little bit lower than to bring it to the whole market. So you need to show basically that you improve the quality of care and that you are somewhat effective and cost efficient, and then you can come to a contract with a special care contract with one specific insurer. And we're currently talking to 2 or 3 big insurers in Germany that might be interested in this digital health solution. So the reimbursement, of course, is part of those contracts, and you would have to consider the disease management and material costs, and then the type of money that you actually are going to save for the insurer. But this is also for the insurer to decide if they see this happening with TIMELY or not, and needs to be part of the discussions with those individual contracts. For Spain, we have planned a stepwise approach. As you have seen, one of our partners is in the north of Spain, in Galicia. The plan is to do pilot programs exactly there with private clinics, so outside of the basic medical sector. A lot of patients in Spain do have specific contracts, private contracts, for additional care, let it be just a regular ECG or a stress ECG or something. So this is very, very common. Then we will also try to get in collaboration with the public sector starting 2027. And there will also be an approach for a national campaign in Spain. So starting in 2026, we can start a pilot program with the private insurers. We need to find out who are the big players here, specifically in the north of Spain. Some of them we already know. We need, of course, to be in line with the regular compliance or be compliant with the regulations that apply. And we have our Spanish partner already looking into this. We will then pitch Timely in terms of pilot programs and collaborate with private hospitals, showing them the benefits of managing the patients and getting in close contact with them regularly. We will also try to collect more data so that we are convincing in the end to show that the patients accept Timely and that we have a very good compliance and also have very good contact to the patient and have good outcomes, because you see that the more active users in Timely there are, the better the outcomes are. In the phase 2, we will be talking to the public sector and try also to see if reimbursement will be possible. This can be done with our contacts to Sergas, which is basically the healthcare provider in Galicia, and we have started those discussions already. We need to see if Timely can be part of the existing healthcare IT infrastructure or needs to be put outside. And then we can, again, run a pilot program and see how it actually would behave in contact with the existing infrastructure and the existing protocols that are already in place. Then in the end, we're planning to do a national expansion all over Spain, which will hopefully then or be preceded by what is happening in Germany, and we can also bring those data to the deciders in Spain. This will then happen 2028 and beyond, and we hope that we can then be in both markets, in Germany and in Spain. There's also other ideas for other countries in Europe, but this would now be too much. And this is basically it. So, Jos, if you would like to join me for the discussion.
Absolutely.
I move over here.
I saw one question that was about what is caregivers were mentioned. Mm-hmm. What is their role in the process? We look at the full system, but you can comment on that, I guess.
I mean, it depends on in which part of what I just showed Timely will be implemented. Let's say the easiest part that I fully oversee would be as part of the intensified rehabilitation aftercare in Germany. So we would have the case managers, which are health experts, that take care of the patients as they have done in the Timely trial already. They will be in very close contact with the cardiologist, the other health experts, meaning physiologists, diabetologists, whatever, in the clinic, in our rehabilitation center, and have their expertise if needed, and then can bring a Timely to the patients. For the other instances, like taking over by an insurer after the patient has left this period of 6 months, I think this is to be decided based on what we already know from the heart failure case. We will have a telemonitoring center, which is usually a big cardiologic practice, and they will then have their experts to take care of Timely.
Yeah, so then I thought part of that question was, what's the role of the caretakers? So the spouses, for example, of the patients, the children, they were also included, at least taken into consideration in the development of the platform. We really asked patients also in what way they appreciate that their family or direct environment is involved in the information that they get. Some things they want to keep outside actually the family, and sometimes they want to have the patient involved, and they're just stakeholders. I mean, just the clinicians, even employees, although we didn't explicitly incorporate that into our development. These are core stakeholders of the platform, I would say. Maybe you can comment on that.
I mean, there's two things here. We asked in the beginning if the patients wanted to share their achievements with family and friends. Yeah. This was basically the biggest difference between Germany and Spain. The Germans said, no, we don't want to share with family and friends. The Spanish patients did want to do that. What we have also learned is we were a bit afraid in the beginning to bring Timely to the older patients because, of course, you would anticipate they have problems with dealing with the devices and the app. I'm sorry. But what we have seen is basically they know who to ask. And these are family members, these are friends, and they know the way around already. So if something new comes up, they take their time, they talk to people who can help. And I think we have better feedback from them than from the younger ones who tend to be a bit on the side. It needs to be quick, it needs to be easy. If it doesn't work in 2 minutes, I don't deal with it. So yes, family and friends are important. And also you need to get them involved because sometimes they have opinions and those opinions don't align with what the medical professionals tell someone. So you also need to convince or at least educate those who are close to the patient that they also understand that it is important to eat healthy, do a lot of exercise. Yes, you do exercise a lot and not like on a very low level, but moderate to vigorous intensity. So you also need to educate whoever is involved in the life of the patients, that's for sure.
Yeah. So I've seen apps also in which patients can selectively provide access to their to caretakers, for example. That's not a feature that we have further developed in our tool, but that's an option that we have discussed, and that might also be a part of a further development of the platform to see how.
Well, as the technical professionals always say, everything is possible. So if we do know that this is something patients want, we can make it happen.
It's a sensitive topic often for them. Yeah. Oh, another question? We can't see them on screen, or can we see them on screen? Sorry.
It's about the approval process of the exercise prescription tool.
Who is asking that?
Susanne.
I don't. Susanne. Okay. Yeah, Susanne, this is of course very important because it's a sensitive issue, but it's very easy. So the moment you enter, we did this on Mondays, you enter the platform, all the exercise prescriptions are there already. You can compare them to the week before. You will have all the necessary information there. Through the whole intervention, we have never seen a single one exercise prescription that was deemed to be unsafe for the patient. They were all within the limits that we set for the tool to obey to. It actually is a 2-stage program. It has a permissibility report which tells you what the patient is allowed to do. The patient sees that too, and then gives you the prescription. So you check the necessary values, you compare it to the week before, you see that there's a moderate deviation in terms of the intensity maybe, in terms of the time, and then you can set it free and approve it, and only if you do so, it will be shown in the app of the patient. Before you do this on a Monday morning, you will see it's still in progress. So nothing goes out in terms of exercise prescription unless you actually save and approve.
CMARC approval, I think that this is to do with device regulation. I think, is that correct, Suzanne Peterson? Is it about device regulation, or is it about further marketing? What can you specify your question a bit further? So I always get them mixed up.
Well, I mean, in terms of approval, we can say that at least since we're measuring blood pressure, we need a 2A certification
CE
for that.
Yeah.
CE is
it's
something
CE
different,
yeah,
right? So
yeah. So to be honest, I just did an exam on the device regulations, and I have to be honest, I always confuse them. We have applied for approval, so in the old regulation it's called for research purposes. That's what we do now. There's also a particular type of regulation that you bring into the market. That is a very extensive project. You have to take at least a year out for that. We have not done that yet, but when that certainly will be the next phase. We have done some. It fulfills conformity regulations, but then for the purpose that we used it. So for research purposes. But to be honest with you, maybe it's better to have a one-on-one, and I can look at my notes as well. I'm not a CRM specialist, regretfully. We spent a lot of time on it, I can tell you that, and we had to do some. We had to jump through some hoops. Yeah.
Well, this is an interesting one, Martin Klotman. So currently, TIMELY will not be a DIGA. Okay, this is a total different thing. You might know that better than I do. Applying for a DIGA is also a thing we consider, but currently this is not the plan. So. But how do we see it compared to others in the market? Of course, we can say that basically TIMELY is the first one that allows AI to be integrated in the platform. I'm not aware of any other platform that actually uses AI. If we look specifically at the rehabilitation case, there is 2 or maybe 3 other providers that have a very specific focus on intense care by the case managers. We put our solution more into the hands of the patients in terms of exercise. We're the only ones, as far as I know, that actually deliver the measured activities and heart rate through our own server to the back end, work with it, bring it back to the patient. I'm not aware that anyone else in the rehabilitation market in Germany is capable of doing that. For now, there's different in terms of DIGA. A lot of them do psychology, some do blood pressure monitoring, but they're only doing this. And blood pressure monitoring is part of TIMELY, but we're doing much more. So I think we're much more comprehensive.
Yeah, I think for the comment on the MDR regulation, that's certainly an issue.
Well, we have the complete AI screening tool of the European Union, and Dimitris was working on this, so we comply with that for sure. Yeah. So we have experts working. Yeah,
otherwise we wouldn't get ethical approval either. So that part is good. So for our purposes, it's good, but to get it to market it,
Roberto has something.
Roberto, yeah.
Now it's working. Now I want to give some additional comments to this question, to the DIGA and also to the certification process. We know that is not an easy process in Europe now with the MDR regulation process. So for that reason, it is a stepwise approach. We make a certification step by step with the features. We want to go in the direction of DIGA together with our cooperation partner Semdatex, so that we have at first a product for the rehabilitation in Germany especially, and also the situation in Europe is different in the countries. Yeah, and in some countries you need a certification process. In Spain or in Greece we have other process, and the rehabilitation is in another segment. So for that reason, it is not easy to say we have one regulated process for certification of this product in Europe. So this is at first a different situation. So in Germany, this is clear. We have this DIGA process, and we will start with the certification process with step by step. We cannot go with the first step to AI approaches. So then we're starting with the normal questionnaire, with the step counter, with the exercise training. I think this is possible. And then we add the next feature is then the blood pressure measurement, and then for that we need a certification as a medical device product. So this is also the way for Semdatics, the main supplier for the platform, and this is really the way that we have to go in the next time, and perhaps we get a foundation for this process, but we will find partners to go in this direction. So it's also the question from Dr. Klutmann, then we will have, I think in the beginning of the next year, we will have a DIGA for revitalization of coronary syndrome patients. And we can add it to the telemonitor center in Germany. We have a special situation in Germany. We have, for heart failure monitoring of patients, we have a special reimbursement in Germany that we have, at the moment, around 250 telemonitor centers in Germany are active and can take over these patients from the rehabilitation site to telemonitor center in the outpatient segment. And this is the situation, a specific situation in Germany. You cannot bring it to all over into Europe, but in Germany, of course, we have the chance bring the patient from the rehabilitation directly in the outpatient segment to the telemonitor center. This is our way, together with the rehabilitation center, with the doctors in the rehabilitation centers, and the doctors or the physicians in the outpatient segment. And for that, we need a certification process, and we're starting.
And I was wondering also, thanks for that, Roberto, whether the question was really hinting at the question, to what extent is our platform unique? And for SAFER, the market research has been done. This is unique, so in its comprehensiveness, but also in its modularity, different modules. Of course, there are elements like blood pressure monitoring, heart rate monitoring, activity tracking. That's very common. That you see that a lot, and maybe there's some chatting system, and there's, I mean, basic app features. You see that a lot, but in the way we have implemented it, but also the separate components, that's very unique. I want to emphasize that. There was something about the AI clearance of MDR.
This is just making clear that MDR is superior to national.
Yeah. Well, there's some issues with AI. So we have an AI powered platform, and that is the AI regulation becoming increasingly severe and protective, which is very understandable. But it also was the case that, for example, when we talk about our chatbot features, some things we could not implement because they are, well, AI is a little bit of a black box, right? So there's always some randomness in there, and so that's absolutely not allowable. We have developed hybrid systems, we have published on that, we have not yet implemented in the platform, and you can find research published by Xin Sun, was our PhD student on the project, who shows that you can have a very safe, regulated AI system, and that will be the next phase in this development.
Yeah, maybe I can add that a lot of AI components have been developed within the project. They're run in combination with the platform in terms of microservices, so you can include them. You can also exclude them, switch them on, switch them off. We have a lot of publications on these out already in peer review. The exercise prescription tool is out currently for peer review, so everything is open and you can actually follow that, how it is done, how it works. The exercise prescription is the lowest level of AI DSS, and there's other things that have a little bit more AI to it, or like the higher levels. But we're trying to use something that is on the line of explainable AI to also bring to the clinicians to see how actually do we come to a conclusion. The team from Forth in Greece has done a great job here, using different indicators and other aspects to make it possible to follow actually the decisions an AI tool delivers. Okay.
Yeah, and we got a few questions about MDR.
Well, these are old. There's nothing new. Do we
No.
see anything new?
If there's
Okay,
any follow-ups on that also,
just
let us
write
know.
to us.
Yeah.
You will find, please follow the project on the website, on X. We have updates there regularly. If you have any questions, write to me, write to Jos, or anyone else from the project. And thank you for joining us today.
Yeah, thank you very much. It's fantastic 4 years, and for all of you who supported us, it was a great adventure, and we're happy with what we delivered thus far. Soon the results will come out in the scientific literature. Wait for it. Watch their screen, as they say in England.
Yeah.
Thank you.
Thank you so much.